I've been practicing for 36 years. Most of my career was in Michigan, but one of my special interests has been the diagnosis and treatment of acid reflux problems. I discovered two things. There were people who were taking medication for acid reflux who really didn't have acid reflux, and they were taking it for no good reason. They started taking it and then they just stayed on it. And there were other people who were taking it, but their symptoms were not adequately controlled. So that combination, from a diagnostic standpoint, said, wow, there's a number of people who really need good diagnostics. And then, once you've done a good diagnosis, then there's an opportunity to sit down with them and work out a treatment plan for them. I sort of retired almost 3 years ago, and that lasted a very short period of time. And I heard about McKenzie Health, and they were looking for a general surgeon, and I'd been coming out for a couple months, and I sort of turned to people here and said, you know, my specialty for 30 years has been diagnosing and treating acid reflux. Are you interested in putting together a program to do that? And they were, you know, everybody said, let's do it. But there are 20 million Americans with acid reflux. We don't really need to do testing on all of those people. The person who needs testing is the person who either goes on medication and it doesn't seem to help, or they've been on medication for years and it used to do a really good job, and all of a sudden they're finding, oh, it's not helping me like it used to. So most of these people have had symptoms for years, and they've just taken their medication. In many cases, if it's not treating symptoms adequately, they just sort of bear up under it, and because not many people know that the diagnostic testing and really alternatives to medication exist.